To help just make sense of everything that's happening, Ashley Brink is with us. She is the director of the Trust Women's Clinic in Wichita, Kansas. And Dr. Colleen McNicholas is here. She is a doctor at Planned Parenthood in St. Louis, Missouri. Thank you both for being here. Okay, so we looked around online, actually, and we found some things that are just, I would like to say, downright disturbing, to say the least. I'm going to list just a few. Mom chat rooms are sharing information on stockpiling Plan B for their young daughters. I'm talking about 7-year-olds. Women are sharing how to get doctors to let them stock up on birth control pills and abortion pills. College applicants, for example, are talking about changing direction and only applying in blue states. Young women are deleting their period tracking apps for fear of their cycles are going to fall into the wrong hands. Ashley, are people overreacting here, or are these in fact necessary steps?
These are absolutely necessary steps. We've seen the urgency. We've continued to, people can say that we have been overreacting, but we've been saying this for a really long time, and now that the time is here. For example, we had patients calling us from waiting rooms in states where trigger bans went into effect when the ruling came down. There is a mass panic, and this is a public health crisis.
How is this all being handled, particularly in Kansas? I'm from Nebraska. Wichita is just down the road, and I could only imagine what is happening in the state right now.
Yeah, I mean, there was already, the infrastructure does not and cannot support this urgency, and we were already struggling to meet the needs of folks who were traveling to us from Texas, from Oklahoma, pushing people out of their communities to access this care, and this is only going to get worse.
Oh, goodness. There are so many things about this conversation that, in my opinion, just don't make sense. And one of them that makes zero damn sense is the number of women who die in childbirth in the United States. If you look at the rate in pretty much every other country in the world, it is going down. Except for the United States of America. We are the largest economy in the world. I want you guys to look at this chart. You see all the other countries with similar economies? They are in the 2 and 3rd level. That's 2 or 3 maternal deaths per 100,000 births. And then you look at the United States. You see that? It is 17.4. We are on par with countries like Turkmenistan and Kazakhstan. And don't even get me started on the fact that black women are dying at a rate 3 times as high as white women. Dr. McNicholas, I want you to weigh in here, because how much is this rate going to go up even more now that abortion in many places across our country is inaccessible?
It is a great point, Simone, and one we should really be thinking about. When I talk about understanding the consequences of this decision, we won't know the full consequences of this decision for even decades, for the very reason that you just said. Maternal mortality is already disappointing in this country, and it's going to rise. We're looking at estimates of somewhere between 20 and 30% increase in maternal mortality. And as you mentioned, it's going to hit the most marginalized communities the hardest. And for folks who have intersecting marginalized identities, Black and brown folks who are also poor, we're talking about rates 30% higher than they already are now. And as you noticed and pointed out on that chart, we are already trailing far behind other developed nations.
Very far behind. I mean, again, I said earlier in this show that the measure of is the measure of a democracy. Many people would say it's how it treats its women of its society, and I think it is a very valid question. If we look at what's happening here, it doesn't seem to be boding too well. I mean, am I being hyperbolic here?
Absolutely not. I mean, we should be not only devastated, but incredibly embarrassed that as a country that purports to lead the world in so many things, healthcare included, that we have allowed half the country to abdicate its responsibility to basic reproductive health care. Abortion is so common and so normal. And quite frankly, it is some of the technically simplest healthcare that I provide as an OBGYN. And we are now forcing people to travel hundreds, sometimes thousands of miles for me to be able to hand them a simple pill. That is embarrassing.
It is embarrassing. Let's talk about this travel piece, though, because there is good news out here. Okay, you make the point about women being forced to now travel to states that are still providing the health care that they need if that health care is an abortion. And there are a number of corporations that have now changed their insurance policies, and they're giving money to anyone who needs to travel out of state to do just that. Apple is one of those companies. Netflix, Starbucks, even though Starbucks is trying to use it to union bus. We're going to talk about that in a different show. Do you think, Ashley, that we're going to see more of this from various sectors of our society, and will it really help?
You know, I sure hope so. I wish it didn't come so late, I guess. I wish they had been doing this sooner. You know, I think what we're looking at now is how can we support clinics that are still operating, help them become and remain sustainable for what is to come. You know, one of the things that we've been looking at here is increasing the available shifts that we have providers available, staffing numbers. What can we do in these states where abortion is accessible that we can ensure that we can see those people if they do have the ability to get here. And that's just, you know, as Dr. McNicholas spoke to, is that it's still a matter of like who has the privilege to access this care and travel and get to where they need to access abortions.
It's a privilege for me. Ashley Brink in Wichita, Kansas, Dr. Colleen McNicholas in St. Louis, Missouri. Thank you both for your insights and your time.
Thank you so much.